live with coverage you trust. This is NBC 10 News.
In our exclusive Health Check 10 report, there's a new, less invasive way to treat a common spine problem. Here's Barbara Moore Silva with more.
It's much easier and a whole lot less painful for Paul Calando to walk these days. Up until a few months ago, his lower back was shot.
From constant lifting and turning.
Paul had what some 3 million Americans suffer from, lumbar stenosis.
Basically, that's kind of narrowing around the nerves in the lower back. And so, typical symptoms of that are trouble walking, trouble with back pain, numbness, weakness, shooting down the legs. It's often kind of in the middle where you get some narrowing around where the nerves come down through the lower back and then also where the nerves come out on the sides.
Paul was in and out of work. He underwent physical therapy. He took pain medications, had regular cortisone injections.
It would last for 4 or 5 months, sometimes less. And I'd be back in physical therapy, starting all over again.
Until he came to see Dr. Charles Kanaly and learned about a new, less invasive fix for his problem.
So standard techniques, you'd make an incision in the middle, go down, and then you have to remove a lot of this normal bone and all these joints here on the side in order to open up around the nerves.
This new, less invasive procedure features a smaller incision and a flexible device.
And we basically just find a little corridor here, a little opening between those bones, which is basically naturally there. And we go down in that area, and then we're able to use a little probe, which is basically just like this one here, and we slide it down through the hole, and we basically track down along the nerve.
Using this flexible shaver device, Dr. Kanaly opens up that area. He shows Paul the before and after on this scan.
These are those same bones you see here. We're able to slide this little shaver device right out through that hole that's really tight. And this was basically how much space you had in the hole. It was very narrow. And after we just shave that open a little bit from the undersurface up, we're able to get this much opening here. So we have much more space for this nerve to come out.
The first week after surgery was difficult.
But every week after that, it got better and better.
And now Paul's doing something he hasn't been able to do in years.
I'm walking 18 holes now, playing golf, yep.
Dr. Kanaly says he's the only neurosurgeon in Rhode Island performing this new minimally invasive technique. He's done 5 so far. Paul was his first patient. He says all have had good results. He performs this new procedure out of 2 hospitals, Memorial Hospital in Pawtucket and Roger Williams Medical Center in Providence. For more on this new procedure for lumbar stenosis, you can log on to turn10.com, use the keyword health. And that's Health Check. Barbara Moore Silva, NBC 10 News.